Hi, my name is Dr. David Rowley. I'm an orthopedic surgeon at Alpine Orthopedic Specialists. Okay, so the ACL stands for anterior cruciate ligament. And there's four main stabilizing ligaments in your knee, and there's two that are on the inside. The anterior cruciate ligament and the posterior cruciate ligament. They're called the cruciate ligaments because they cross in the center of the knee, making a cross. And what it does is the ACL provides rotational as well as anterior stability to the shin bone or the tibia on the thigh bone or the femur. And so what happens when you tear your ACL is that ligament tears and it allows the shin bone to twist. And when that twists and when that shifts forward, it can cause an injury to your meniscus, which are little discs on the inside of your knee. So with a patient that has ACL instability or ACL insufficiency after an ACL tear, what can happen is when they ski or run or pivot or hike or do normal activities, the tibia or the shin bone can twist and it can come forward, and that can cause more damage to the cartilage or it can cause more damage to the meniscus. And so when we do ACL surgery, what we're trying to do is recreate the stability in the knee so that patients can regain their normal activities and do the activities they like to do. So what ACL reconstruction consists of is drilling two new sockets, one in the thigh bone and one in the shin bone, and then putting in a new ligament that's taking the place of the ACL. We can't do an ACL repair. What we do is an ACL reconstruction because the damage is so severe that you cannot repair the actual ligament. So you're doing a reconstruction, putting in a new ligament. And the technique that I use is a newer technique. It's called Anatomic ACL reconstruction. And it's matching the anatomy of the femur, of the thigh bone, and also the shin bone, and putting it back exactly where it was to begin with, which then will provide greater stability to patients down the road.